Hello and welcome to the Physio channel. In this video we're going to have a look at what are scar adhesions and how to tackle them. Now I'm not exactly sure of the plan for this video, but Emma Holly, scar therapist, has assured me that all I need to do is be the model for you. So watch and enjoy.
So a lot of people ask me about scar adhesions, and it is something people should really be concerned about, particularly if they have any scarring in the abdominal or pelvic regions. And why do I say that? And it's because research has shown when you have a surgery or a trauma in those areas, the likelihood of scar tissue forming adhesions, which means sticking between two normally separate areas of tissue, and that could be onto an organ, it could be onto muscles, any underlying structure could be stuck to another underlying structure. That can really affect function, so it could affect digestive system, it could affect bladder function, it could affect liver function, diaphragm function. And so I'm just going to do an operation on Daniel in a moment and look at what are adhesions, how do they form, and how do we need to think about them in a therapeutic sense in terms of being able to help. So I'm just going to get Daniel ready down on the surgery table. Now here I'm specifically going to focus in on somebody who's had surgery. For most abdominal surgeries, your client will have had the surgery whilst in this position. So what's really important to think about is the position of the tissues on top of one another, and how once you start, so I'm going to pretend that the t-shirt that Daniel's wearing is actually his upper layer of tissue. So if a surgeon was going to cut through this tissue onto the underlying tissue, the adhesions that are likely to form are going to follow that same pathway of tissues which sit on top of each other. So if I cut through, let's say to get to Daniel's appendix, let's say it was about to rupture, I'd cut through the skin, I'd cut through the superficial fascia, I'd cut through all of the layers of tissue and all the fascial layers in order to get to his appendix, which are in a certain position with the muscles totally passive in this position. For the sake of this video, we're going to pretend that appendixes are really interesting to look at, and I will encourage you to look at those, but just in terms of ease of kind of visual impact, we're going to pretend that Daniel's had a keyhole surgery, so there would be multiple incisions going deep. Let's say he's had a laparoscopic investigation for something. So the t-shirt being his skin, and I'm just showing how the skin can stick onto the underlying layers. In this position, if I stick the t-shirt where it sits as he's laying at the minute, down onto the underlying tissue, that is then creating a mock adhesion in that position. So that skin is getting stuck onto any underlying structures in this case. I'm interested if it was attached to the fascia wrapping around his abdominal muscles. And then when he changes position, we're going to look at how that might adjust, how that's sitting. So Daniel, if I get you to stand up. So Daniel, having finished his surgery and gone through early recovery, has unfortunately developed some adhesions or some sticking through that incision point. So yeah, if you stand sideways, hopefully it can catch on camera the gathering of your material in this position. And if you just move your body around a little bit, are you aware of some slight pulling or restrictions through that area?
I am. It's particularly restricting me going back into extension.
So flexion's fine. So a lot of people in early recovery after an abdominal surgery will want to fold forward, which means during early recovery this is more likely to kind of compress and isn't ideal for healing. And actually, yeah, that stretching and elongating of those fibres as they mature is going to be more uncomfortable. So it's more likely that as a client you're less likely to want to go into flexion during your healing. Now this was obviously only one point. If you'd had surgery, a keyhole surgery for example, it could be that it's much more pronounced in one area than the other. If there'd been something like an appendix which perhaps had any spilling of the infection into the surrounding tissues, that's so much more likely to cause some adhesions. And so it's a really important one to look out for. If you get your client to move around after a surgery and see, do they say, oh, actually I feel some pulling, some restrictions as a result of this. So if we thought about where his tissues were laying when he was totally passive on the operating table, and now his abdominal muscles are functioning because he's holding himself upright, as those tissues contract, the scar gets pulled ever so slightly upwards, which is why his t-shirt is, as you can see, it's not wanting to sit flat, and it's the same with the skin. You can't always notice it without moving the tissues around, but when you do a scar assessment, you can often find when somebody's had some problems with their healing that they do develop visible adhesions. Not everyone develops visible adhesions seen from the skin surface, but lots of people do, and it's really good to be able to assess for them. So what we've got is a shortening of tissues between here and the muscle where it's attached, which would be sitting above, because when he was passive, they were sitting directly on top of each other, and now the muscles are active, the shortening is occurring above the puckering. So what's happening is the area below the scar is having to facilitate more stretch than the area above, which is refusing to stretch. So what we've got here is, as the tissue is sticking, when he was laid flat, it's likely that the adhesion might have developed straight down through the different layers that were cut. And as Daniel has stood up, the underlying tissues, as the muscle contracts, pull upwards, which is why we've got the slight pulling of the tissue upwards. The fibres and the tissues below are having to give. They're having to facilitate this to happen, because this is all healthy tissue below that was less impacted during the surgery, and the area that doesn't want to move, if I tried to pull this, it would be locked downwards, so I wouldn't be able to get much downward movement, but if I tried to slide the tissue upwards, I'd be able to get more movement in an upwards direction. That will inform me that the restriction and the shortening of the fibres is occurring above that scar adhesion, as opposed to in the other direction. And obviously it's going to depend on the surgery, on the individual, on what happened during their healing and so on. So I'm not saying they always form in this direction, but in this example, the scar tissue is often caught on the muscle and therefore pulls upwards. Different ways we can approach that in terms of therapeutic treatment to help improve and elongate the fibres which are shortened and contracted where the adhesion is. So first of all, we could get the rock blades out using the silicone tool. So what I've explained is this tissue is giving a lot and the tissue above is not. So I'm going to lock in above the scar and ask Daniel to go into flexion and then into extension. So I'm sinking in now and flexion again. So always come into ease before going in towards to do the stretch. Should feel quite nice. And what that's going to do is that you want to be really quite close to where the scar adhesion is, but not directly on it, because we don't want to compress tissues which is already shortened. So slightly above it's a good idea. Pin just above the scar, get them to come into ease of movement, and then take that through range movement, allowing them to inform you if there's any discomfort, any increasing pain that they need to stop. So that is a really good way of treating it. When he's lying down, very well maybe looking totally flat and not noticing any adhesions, any pulling or puckering at all, because he's back in the position that he would have been in surgery, so it'll all be lying lovely and flat. If you want to notice adhesions through the abdominal area, you need to see your client standing up. So you may no longer notice anything in this position, but once you've assessed in standing, obviously it can be a really good idea to get the client on the therapy table in order to do some treatment. So using the rock blade tool, doing that nice feathering can be a really good thing. You can try and see if you can do some of the stretching and sort of resistance with the silicone on, but usually with abdominal areas, this is going to be really hard to achieve with the client lying down, because if I hold onto the tissue, I then have got nowhere to go with asking Daniel to be able to make a movement. So it's probably not something that I'd do in this position. You'd have to do those active stretches of any adhesions when the person is standing up. But other tools that you can really easily use is to think about using negative pressure, sometimes called vacuum massage, or also known as cupping, and also known as rock pods. So suction in which to create a lift. We're talking about tissue which is adhered or stuck down. So first of all, I wouldn't go directly on the scar immediately, and I wouldn't use this until I was really sure those tissues have knitted together, putting a strong suction over newly reepithelialized, so new skin that's just grown, is not a good idea. So once you're sure you've got skin which is robust enough to tolerate some suction, some pressure over it, then it would be a good idea to start with something like the rock pods. I tend to do some treatment around the area first, so applying the rock pods around the area, and then do some passive cupping, some soft tissue mobilisation, just to get that whole area moving. And it can be really helpful to have your spare hand on near the area so you can really feel for any restrictions which may present themselves as you take that tissue through full range of movement. It can be that you feel some thick cordy fibres coming to the surface as you mobilise the tissue through that 360 range of motion. And as long as the tissue is robust enough, you can definitely use these techniques directly over the scar itself with sufficient training in working over scar tissue. Now, another tool that you may want to use, and I commonly use when I'm working in clinic, is to use rock tape in order to counteract the adhesive force that's going on in the tissues, because it provides ongoing counterbalance in the coming days, if they can keep it on for a few days, which is going to really take that treatment on further than just the time that they've got with you in clinic. So in this case, we've got a scar which is sticking upwards, and again, I would want to see Daniel standing up to be able to apply the tape for this. So here we've got a client that when they're stood up, you can see some pulling or some puckering occurring in the scar. So if I was to look at Daniel, what I would expect, if this was the scar line, that it, one, is indented compared to the skin around it, so it's more pulled in, and potentially has got a slight lip or overhang in one direction. Now, the area which has the biggest overhang, it could be coming from underneath, so it's more of a bulge underneath rather than a lip over the top. That tends to be the direction in which you want to increase the, use the rock tape to counteract the shortening of the tissues. So the area that we want to really try and elongate using the rock tape is the tissue between the skin and above it. So we want to, it's being pulled in this direction, and we're going to use the rock tape to counteract that and pull the tissues in the opposite direction. Therefore, it will feel is even more challenging than it was before, because you're actually adding in sort of self-massage, if you like. Think about the directional pull, so test it, and the area in which it least wants to move, so it might be that it doesn't want to come because it's stuck straight up, it might be at a slight angle that you've got the biggest resistance, and you lay your tape parallel to that resistance so that you're really going to try and block off behind the resistance. So in this case, I'm going to pretend it's really resistant, it's coming from this direction, so there's a shortening and a pulling up to the side there, which is what I commonly see in clinic. I'm less worried about the tape above the scar is just catching the tissue to make sure you disperse the pressure that you put on. So I'm less worried about how much tension you put through that scar. What I'm more worried about is what you're catching. So obviously make sure that the tape is on the skin and not tape on tape for the attachment. Then I don't tend to tape directly over the scar, but I want to come right next to it, and I want to add a little bit of pull there, and then obviously no stretch at the ends. So what you should then do is test your client and ask them to again repeat that movement where they're going into extension, and they should feel a pull around the scar. The aim of this is to actually make that area work harder and really try and force that tissue to remain in place. So essentially what I'm thinking about is, if this tissue remains in place and Daniel goes into extension, the tissues behind it, which are stuck to the tissues below and around it, are forced to elongate to facilitate that movement, and they're having to fight a bit harder because of the tape, in which case hopefully you'll stretch them a bit more, which means that then they become used to a bigger range of movement. That's the aim of that. So the way I applied it was the panel above the scar was non-stretch, so we've put some dashed lines across here, and then the whole point is the adhesion is pulling upwards, and we're using the tape to counterbalance that, so we're actually putting the stretch in the opposite direction. So no stretch, and then stretch through the mid panel, obviously no stretch at the end, and what that's doing is that's creating an additional restriction. So you're adding to the restriction to make the body work harder, to force it to elongate fibres which are wanting to be contractile and short. So your client should feel, and Daniel should feel, when he goes into extension now. So an increase in sensation of restricted movement is actually what you're aiming for, which isn't necessarily what you'd usually look for when you apply kinesio tape. But the whole point is this is very specific for working against adhesion formation to try and elongate the fibres.
Thanks for watching this video, and thank you to Emma Holly for sharing some of her fantastic specialist scar therapy advice with us. So please subscribe, like and leave a comment, and don't forget, if you'd like to find out more about our work and Emma Holly's work, have a look in the description for this video. We'll pop some other videos up on the screen here which may be of use to you or interesting or helpful, or you may wish to share them with somebody who you think may benefit from watching them. As for now, thank you, and we'll see you in the next video.